negative counter plan is ineffective because by having the drug available over the counter, you are giving students more opportunities to misuse the drug instead of for educational purposes. According to illicit use of prescription ADHD medications on a college campus, a multi-methodological approach, Alan DeSantis 2008, researchers found that non-medical prescription stimulant users were more likely to participate in the use of alcohol, cigarettes, and illegal drugs such as cocaine, marijuana, and ecstasy, along with more high-risk behavior. You also related Adderall to other prescription drugs, but Adderall can be potentially more dangerous because according to Renda 2011, Adderall can cause heart palpitations, increased blood pressure, headaches, chest pain, hallucinations, insomnia, and weight loss. These are symptoms that are generally associated with street drugs such as cocaine or heroin. But the misconception that prescription drugs are safer is entirely false. When abused, these stimulants can hook users and produce undesired fatalities. In fact, Adderall can become so addictive that it can affect the brain like cocaine or methamphetamine. If Adderall is available over the counter, it can also lead to addiction. According to ADHD prescription abuse rampant on college campuses, Renda 2011, Adderall addiction has been linked to student heart-related deaths, stroke, and suicide. Adderall abuse can also lead to the development of other addictions in the future. Disadvantages. You say that the cost would be more expensive if there are stricter rules, but if you have stricter rules about who is prescribed the pill, then it would actually be much harder to sell because those who would be prescribed would actually use the drugs for medical reasons instead of for recreational. Therefore, the cost of monitoring is worth it because it keeps the pretenders out. Relating to the argument I just made, you discussed misuse of Adderall, but there will not be misuse and addictive behavior if it is closely monitored. Doctors and pharmacies can monitor it by only allowing a specific number of prescriptions per person, making ADHD stricter and having stronger examinations. Case attacks. You argue that Adderall is a very legitimate drug when properly prescribed. According to ADHD prescription abuse rampant on college campuses, Renda 2011, it states that doctors are prescribing Adderall to too many people, which can lead to the drug getting into the wrong hands. Therefore, we need to monitor it more instead of allowing easy availability. By allowing it to be over the counter, as stated above, doctors need to be more precautious about prescribing this drug by administering more examinations. You also said that taking Adderall does not increase the risk of heart disease, but according to the article Short-Term Cardiovascular Effects of Methamphetamine and Adderall by Niehaus, PhD, 2009, it may not be a lot, but it's still a vital organ that should be taken seriously. By not taking Adderall legally, you can save your life. Don't you want to live a longer life? Take control over your life and reach out to help from professors and study workshops instead of taking a risky drug that only helps you in the short term. Adderall is a gateway drug because, as previously mentioned, students from colleges with non-medical prescription stimulant users were more likely to report use of alcohol, cigarettes, cocaine, marijuana, and ecstasy, along with other high-risk behavior. Once an illegal user of Adderall decides the drug is not enough, it is easy for them to turn to even more risky drugs that can shorten your life even faster. Therefore, Adderall can be a gateway drug. So, therefore, don't use Adderall illegally. Fight the urge and just say no.
Counterplan, disadvantaged case attacks. Counterplan. Adderall should be available to students over the counter in small doses. College has many stressors that students struggle with. The counterplan allows students to access Adderall more easily so they can focus on their studies more. The affirmative thinks that there should be more strict rules on how to access the drug, but we believe that if monitored carefully, the drug can successfully be sold over the counter. Having the drug being monitored and being more available will help the students deal with the college stressors. Both the plan and the counterplan have its downfalls. The original plan is ineffective because it is impossible to completely monitor the drug. The counterplan is ineffective because people can have more of an easy access to the drug. You stated that our counterplan is ineffective because the students are more likely to misuse the drug. We mentioned before that any drug can be wrongfully used, and according to Kuehne, most patients who abuse a medication typically already have a history of drug abuse. Therefore, your plan can be seen as ineffective as well. Your other arguments stated that Adderall can potentially be more dangerous than other drugs. According to Niehaus, researchers studied that medical records, children and young adults aged 2 to 24 who were taking or had taken stimulants such as Ritalin or Adderall and found no signs of increased heart problems. So we don't see any evidence of increased risk. According to Dr. William Cooper of Vanderbilt University, he said that there is no evidence that prove of heart problems. According to our evidence, there is little information regarding if Adderall can truly affect your health. Another point that you made was that if Adderall is available over the counter, it can also lead to addiction. This statement can be true, but that is for those who don't use it correctly. Andrea Nurko wrote that it is a very legitimate drug when properly prescribed. Our counter plan offers monitoring so people can't abuse it. Disadvantage. The affirmative talks about how they don't think Adderall should be for recreational use, but you do not have complete control over the use of any drug. Your plan can also cost extra money to monitor. Since monitoring costs extra money, you have to charge the patients extra for prescriptions, which can cause them to sell it, leading to illegal use. If people are selling it illegally to non-prescription users in a heavy dose, then this means that people are taking it who don't need it. This can lead to misuse and addictive behaviors. Your first argument was about those who are prescribed the drugs by strict rules who won't sell it because they need it for themselves. Our economy might prove this otherwise. When things are in low supply, demand rises, which causes prices to rise. People may offer to spend more money for the pill. This can create temptation into the prescribed users, which can cause them to sell their pills for huge profit. Therefore, there are always ways for the pretenders to find a way in. I agree that you cannot completely control Adderall usage. The more you monitor it, the easier it may be better to control. But if someone actually needs to take the pill, the qualifications might restrict them from doing so. You do not want to monitor something too close, that it can keep all the users away. You also suggest that if ISU informs students more about the harms of Adderall, that they will be less likely to misuse the drug. There are many other dangers, such as alcohol, that we are informed about everywhere else on campus, but it has not affected anyone. I believe that informing people about Adderall would have the same result. People are aware of the harms, but it does not stop them. Case attacks. You mentioned that doctors are prescribing too many people Adderall. Could it be possible that ADHD and ADD are on the rise? With the population constantly growing, more people attending universities, and more daily stressors, people are probably realizing that they need extra help from Adderall. We live in a stressful environment, and some people need the extra push. It seems as if our findings differ with heart disease. Ours say that there is no link to heart disease, while yours states otherwise. I think the problem here is not who's right